so excited to have Lupe Cruz here today with us from LDS Hospital, and we are talking about something out there that lots of moms, if you've had one child and had to have a C-section but maybe don't want to do that the next time around, there are options out there for you, right, Lupe?
Yes, there are.
So let's talk about, it's called a VBAC. What is a VBAC?
So a VBAC is actually what it's called after you've had the baby after the cesarean section. So what it's called initially is a TOLAC. So it's a trial of labor after cesarean. Once that is successful, then it's called a VBAC, vaginal birth after cesarean section.
Okay, so people are very, like, some people would like to do a C-section again, some people would like the experience of giving birth. What are the risks involved in doing a VBAC?
So some of the risks involved are, of course, if it doesn't work,
okay.
So then you end up having a C-section again.
So when you say if it doesn't work, what does that mean? So like if there's complications or problems or just any sort of...
Complications, so there could be complications with mom, there could be complications with the baby, there could be uterine rupture.
Okay.
So where the old scar is, that could be a weakened area, or above or below it.
Okay.
The uterine wall could become weakened. So we look for things like if there could be a uterine rupture, and that would call for an emergency C-section.
Okay. Well, what would the benefits of a VBAC be, though? Why would people want to do the VBAC?
The benefits would be that you don't have to have another surgery. A C-section is a major abdominal surgery. Less infection, of course. You're not opening the abdomen. Less time in the hospital afterwards. You get to go home sooner. Less risk of blood clots. The babies will oftentimes do better, so less breathing problems, less pain for mom.
So after you've had a C-section, are the percentages of actually having a vaginal birth a lot less moving forward? Or is it kind of dependent? Is it just kind of up in the air?
It really depends on why you had the C-section to begin with. So they can vary anywhere from about 60 to 80% success rate. And it really depends on why you had the C-section. So was it because of the position of the baby? Was it the mother's pelvis? It could have been, was the baby in distress? Was the mother, was it something with the mother? So we have to really look at all of the aspects of why the C-section was done.
So who should consider doing this after a C-section?
So some of the things you could look at is the way that the C-section was done. So a woman who's had a low transverse C-section, so that's a C-section that's done at the bikini line, so it would have probably been one that was a little more planned. Emergency C-sections or really quick C-sections aren't always done so nicely just because they've got to get it done really quickly. And one that's done at the bikini line on the outside doesn't always mean that it was done that way on the inside. So the uterus has to also have that low transverse uterine incision. So that's something that we look at. And you can also do it if it's going to be an induction. You just have to be a little bit more monitored. And then you'd also want to consider the backup plan. So if you're going to be in a facility that has the ability to have an emergent C-section or an urgent C-section should the vaginal birth fail.
I have a question just because I'm ignorant to this, but are there certain situations where if you'll have a C-section and your doctor will tell you moving forward, like, you will never be able to have a vaginal birth, like you should always get C-sections now? Or is it kind of just dependent on the next pregnancy and how that all goes and how your body performs?
Well, every pregnancy is different, but I would say if there are structural issues with the woman's body, so that the shape of the pelvis, or maybe spinal issues, that would be maybe an issue where you may not be able to have a vaginal birth.
Okay, interesting stuff. So moving forward, if someone has more questions and wants to know if this is something they should consider, what is the best route to take?
The best route is always to speak with your provider, because every case is individual. Every person has a completely different set of circumstances of why they had a C-section to begin with.
Love it.
Okay, well, be sure to go and check out their website, ldshospital.org/healthyliving, for more information. And if you have any questions, be sure to call the number that's up there on the screen. It'll also be linked from our website. Thanks, Lupe, for being with us.
Thanks, Lupe. Good stuff.